When Chief John Ross led the Cherokee tribe out of the South onto the Trail of Tears in 1838, he had no way of envisioning what his people would one day build in the hills of Tahlequah and the potential it would have to change the lives of all Native Americans for the better. The Cherokee Nation Health Center is the largest tribal outpatient clinic in the United States. 2 football fields long and impressive from every angle. The facility opened in October and is already a game changer in healthcare, not just for Cherokees, but for every citizen of a federally recognized tribe.
There's 2 counties in the Panhandle that we did not see patients from. Otherwise, every county in Oklahoma has had a patient who comes here. Not only that, they come from other states. They come from Colorado, Texas, Kansas, even from as far away as Virginia and Florida. All of this, 4 stories, 469,000 square feet, paid for by the Cherokee Nation at a cost of $200 million. But the clinic itself will be staffed and operated by the Indian Health Services at a cost of $100 million per year. That financial commitment did not come easily. It required intensive negotiations to convince the federally operated IHS to reopen its then dormant joint venture program.
So that program had largely been shuttered when my predecessor, Chief Baker, came into office. I worked for him at the time. We had to go to IHS, we had to go to members of Congress and convince them that they should do it, that it was the right thing to do. And when we reminded them that they're more than $1 billion behind on infrastructure and Indian country health care, that was part of the discussion.
The government eventually agreed, and with the funding in place, the building began. And what a building it is! The hallways are filled with wonderful Cherokee art. These masks representing the 7 Cherokee clans. This interactive light display welcoming parents and children to the pediatric ward. Everywhere you turn, there is art that depicts, explains, and celebrates Cherokee heritage and history. In reality, not only do you come here for the health care, but it's also you can look around and you can see where your roots came from. It's very culturally sensitive.
Well, this is like a museum. I understand we have over 600 art pieces here. So that's even without the health care. You're coming to a beautiful facility.
Cynthia Cabin works at the clinic, registering patients for their appointments. But on this day, the Cherokee citizen had her own appointment with Dr. Nolan.
So we'll get that put in. And then
I think the quality is really, really good. It's still kind of a hometown feel, you know, and they spend plenty of time with you.
Plenty of time and space.
At one time in the other facility, it was built to have 65,000 outpatient visits. Last year we had about 450,000 outpatient visits. So we were busting at the seams. This is truly a game changer.
The original Hastings Health Center sits next to the new clinic and continues to operate as an inpatient hospital. But in terms of size and state-of-the-art equipment, there's simply no comparison.
One of the big upgrades in our services is the imaging department, where we've added 2 new CT scanners and 2 MRI scanners. This is a 64-slice CT scanner, 2 dedicated CT scanners for outpatients, 2 new MRI scanners that we've not had before.
There's also an in-house optometry department, a volunteer staff assigned to help you get you where you need to go, and if you're hungry, a shiny new cafeteria too. You get the idea. This place is pretty great, and a great example of how healthcare delivery can be transformed in rural and underserved parts of Oklahoma.
There's parts of Indian country that need a lot of help, that need to get more advanced in their healthcare delivery. I think they can look to our model and see a way to have success.
That model will be complete when this building is. Located just a few hundred yards from the outpatient clinic, this will be the first tribal-affiliated medical school in American history. And like the clinic, it involves a partnership, this time with the OSU School of Osteopathic Medicine in Tulsa.
So there's going to be these opportunities for these doctors to get their training in our setting, in a rural setting, in a setting where you're dealing with native populations. We think that'll make them better doctors, and we think it'll make them very suited for this region. So it's a win-win for OSU and the Cherokee Nation.
The inaugural class of 50 students will begin school in August.
It's really gratifying, just all the hard work that I put in just to be able to be a part of something such as that. And as a member of the Cherokee Nation myself, to be an inaugural member of a Cherokee Nation medical school and a Cherokee Nation class, that's something I'm really proud of.
It is certainly a win for the Cherokee Nation, but for me, I view it as a win for the greater population of Native Americans. You know, to say that Native populations have a forefront in medical education and that this will be a medical school that emphasizes their direct needs is important to all nations, not just the Cherokee Nation. And so to have the opportunity to be a part of the first medical school that will be tribally affiliated just seemed too perfect to pass up.
So the first class will have 50 students, but the goal is to have 100 students in every class in the years following that.